Good morning to one and all. Hope you all are doing good. So, as far as I know, you people are the fresh third year batch, right? So now that you will be getting into the clinics now, you have to know all the clinical subjects in detail. So, before going into the details of orthodontics, you really have to know what is orthodontics, and you have to know a brief history of orthodontics. So today let me just give you an introduction to orthodontics and a brief history. So moving on to the contents. So today we'll be dealing mainly on the definition and the aims of orthodontic treatment, the scope of orthodontics and the branches, and finally a brief history of orthodontics. Okay, so what really orthodontics means? The word orthodontics is derived from a Greek word orthos. Orthos means to correct, and odontos means teeth. So that's how the name came, orthodontics. So the definition of orthodontics as given by British Society for Study of Orthodontics, they have given a definition in the year 1922 that the definition goes like this: orthodontics includes the study of growth and development of the jaws and face particularly, and the body generally, as influencing the position of the teeth, the study of action and reaction of internal and external influences on the development and prevention and correction of arrested and perverted development. So you have to by heart this definition. There is no other way. So each part of this definition, the growth and development, and the each part, prevention, correction, preventive orthodontics, corrective orthodontics, everything is a separate chapter by itself. So you don't have to worry about all that. We'll be dealing it in detail in the coming classes. So why do we really need orthodontics? So why people or why patients approach for an orthodontic treatment? What is the sequelae of a malocclusion? You know what a malocclusion is, right? So what is the sequelae of a malocclusion? There are many sequelae for malocclusion. That is, the major one is poor facial appearance. That is why 90% of the patients come to an orthodontic clinic because of the poor facial appearance. And the next one is the risk of caries. When I say risk of caries, I mean to say that when the teeth are irregularly placed, or when the teeth are crowded like this, you can see in this picture, when these teeth are crowded, the patients cannot really clean their teeth effectively. However hard they try, they cannot clean these proximal surfaces effectively. So there is a chance of developing caries in these surfaces. So that's another sequelae of malocclusion, that is risk of caries. Next one is a risk of periodontal diseases. Okay, when I say the risk of periodontal diseases, I mean to say that when you have a traumatic occlusion, like in this picture you can see the patient has a deep bite, right? The patient has a deep bite. This kind of a malocclusion or this kind of a bite can weaken the periodontal health of the lower incisors. This kind of a bite can weaken the health of the lower teeth. This is another kind of malocclusion that can also lead to periodontal diseases. Because of this traumatic occlusion, the periodontal health of the teeth or the support of the teeth, the support of these teeth is lost or reduced, that can lead to periodontal diseases. Okay. The next one is psychological disturbances. That we already know that when a patient has a poor facial appearance, he might have some psychological disturbances as well. And the next one is risk of trauma. Risk of trauma means that when a kid has a severely proclined teeth, when the teeth are severely proclined, there is a high risk that when he can injure his teeth during a play or by an accidental fall. He can injure his front teeth when the front teeth are severely proclined. Okay. Then there is there can be abnormalities of function. Mean to say that there may be because of malocclusion, patients can develop some abnormalities in speech, can develop improper respiration. That is what we mean by abnormalities of function. And the next one is temporomandibular joint problems. So when a patient has a traumatic occlusion or when a patient has a deep bite, there is always a chance that he might have a temporomandibular joint problem as well. Okay, so these are the sequelae of malocclusion. So what are the aims of orthodontics? So the aims and objectives of orthodontic therapy can be summarized by Jackson's triad. This is called as Jackson's triad. So the main objectives are functional efficiency. The first one is functional efficiency, second one is structural balance, and the third one is aesthetic harmony. Functional efficiency, structural balance, and aesthetic harmony. So now we can go into the details of these. So the first one, as I told, is functional efficiency. So as we already discussed in those sequelae of malocclusion, we have already told that many malocclusions can affect functioning, right? It can affect the functioning of the stomatognathing system. When so our treatment should aim to correct these functional deficiencies also. The second one, so now the second one is structural balance. Okay, so this orofacial system, or the orofacial region, consists of we have the teeth, the alveolus, the skeletal tissues and soft tissues, and the muscles as well. So in the orofacial region we have the teeth, alveolus, muscles, jaw, etc. So for a treatment to be considered as stable, there should be a balance between these systems. That is, a balance between the teeth, the alveolus, the muscles and the jaws, the skeletal system as well. Okay, that is what is called structural balance. So the orthodontic treatment should maintain a balance between these structures. Okay, the structures of the dentoalveolar system. Okay, and the third one is aesthetic harmony. Aesthetic harmony, that is the main reason why people seek orthodontic treatment. So they come to an orthodontist to improve their appearance of the teeth or face. Okay, so we should aim to improve the aesthetic harmony. Okay, so that's the Jackson's triad. First one, functional efficiency, structural balance, and aesthetic harmony. This is very important. Okay, so now we need to know what is the scope of orthodontics. What all can be done with orthodontics? An orthodontic treatment results in what all changes? Okay. Many people think that with orthodontics we can just move the teeth only. It's all about the teeth only. But it doesn't stop with the teeth. It's not just orthodontics, it's orthodontics and dentofacial orthopedics. The branch is not just orthodontics, it is called orthodontics and dentofacial orthopedics. So, orthodontics, yes, moving the teeth. So, and dentofacial orthopedics means dentofacial orthopedics. So, it is something to deal with the facial skeleton as well. The bones, orthopedics, the bones. The dentofacial orthopedics, the bones of the dentofacial region. Okay. So, yes, orthodontics means moving the teeth. Alteration in tooth position. Yes, it can bring about alteration in the tooth position. Now, you can very well appreciate from these pictures. This is depicting a patient with a malocclusion. That's the teeth is protruded. This after orthodontic treatment. The second picture after orthodontic treatment. Okay. You can see in this picture that the patient's teeth is proclined. And in the second picture, the proclination of the teeth is corrected. And here you can see that the maxillary bone, this is the maxilla and this is the mandible. The maxilla is well ahead of the mandible. The maxilla is well ahead of the mandible in first picture, but here you can see that the maxilla and mandible is in a perfect relationship. Okay. So it has now corrected the teeth, it has corrected the skeletal pattern as well. It has corrected the skeletal pattern, and now see the soft tissues, patient soft tissue. You can see the soft tissue prominence in the first picture. It is very protruded, unaesthetic appearance. And now you can see in the second picture after orthodontic treatment, the soft tissues is corrected as well. So it can bring about alterations in tooth position, in alterations in the skeletal pattern, and alterations in the soft tissue pattern as well. Okay. So it's not just about the tooth. So orthodontics has four main branches. Four main branches meaning to say that it deals, the first one is preventive orthodontics, interceptive orthodontics, we have the corrective orthodontics, and we have the surgical orthodontics as well. So, what is preventive orthodontics? Preventive orthodontics, as this session is about to expire. It's just 15 minutes. So, we'll